Welcome to Tuesday's edition of COVID-19. I'm Min San-hee. Korea is starting today with exactly 100 cases today, and a third of them are imported. Speaking of imported, the situation elsewhere around the world remains severe, but hopes are mounting for some form of control over the situation in the U.S. under a Biden administration. We have details on that later on in the program. Here first is our Kwon So-ah with the latest numbers on the pandemic. So again, let's begin on the local front.
Yes, Sunny. Korea posted a lower single-day caseload on Tuesday compared to Monday, with exactly 100 new infections. But authorities are considering whether they will have to raise the social distancing measures from level 1 to 1.5 if the numbers remain at around 100. Now, it marks the third straight day that we are seeing triple digits. But if we take a look at this graph, which divides the domestic and imported cases, we see that cases that were brought in from abroad have been remaining pretty similar in the past 3 days, while we are actually seeing a downward trend when it comes to domestic transmissions. And with that, in total, Korea has 27,653 COVID-19 cases, with 485 deaths as 5 more people lost their lives in the past day. We have 2,008 people remaining under treatment or in quarantine, and 25,160 people have fully recovered from the disease. And by region, we see that the capital Seoul posted the highest number of infections this Tuesday at 35, followed by 33 in Gyeonggi province. What is good news is that we do not see any double digits in other parts of the country this Tuesday. Meanwhile, out of the 29 imported cases that we're seeing today, 16 were from the U.S. And if we take a look at the U.S. here, which is still the country with the highest number of infections, 10.4 million here. And we also see that 2 countries have now over 500,000 cases here. Belgium and Iraq have made that milestone in the past 24 hours. And now let's take a closer look at some countries with the highest rise of infections. Here again, the U.S., as of noon Korea time, over 130,000 new cases. And also Italy, very serious here with over 25,000 new infections, and similar increases in Russia, the UK, and Poland. So really, the secondary wave in Europe is continuing at a serious rate. And with that, the world has over 51.2 million cases, with over 500,000 new infections reported, as well as some 7,140 new fatalities.
Right, so despite those grim numbers, I hear there's been some positive achievements on the vaccine front.
Yes, Sunny. A vaccine from drug maker Pfizer and its co-developer BioNTech was found to be more than 90% effective in its first analysis of the third trial. Today is a great day for science and humanity, is what their press release said. While it is still unclear how much protection it provides to which age group and for how long, scientists are expressing their cautious optimism. And on that positive note, I will toss it back to Sunny, and I'll be back after the government briefing.
Right, so thank you for that. And staying on the international front, a new leadership is poised to take over the helm of the U.S. White House early next year, and efforts to tackle COVID-19 appear to be at the top of the to-do list. Now, for more on this, I have our Yoon Jung-min here in the studio. Welcome, Jung-min.
Hello, Sunny.
Now, Jung-min, let's start with Mr. Biden's intentions to make the pandemic a priority.
Sure, Sunny. So Biden addressed the nation on Monday after meeting with his COVID-19 advisory board, calling for unity and simple preventive measures to curb the pandemic. He once again pleaded with American citizens to wear a face mask. Take a listen.
I implore you, wear a mask. Do it for yourself. Do it for your neighbor. A mask is not a political statement, but it is a good way to start pulling the country together.
He also revealed the names of the 13 experts who will make up his COVID-19 task force. They include Dr. Vivek Murthy, who led the U.S. Public Health Service Commission Corps under the Obama administration, and Rick Bright, a whistleblower from the Trump administration who was ousted from his post for exposing the president's mishandling of the pandemic. Biden has pledged to scale up testing capacity and ensure that all Americans have access to testing and promised to double the number of drive-through testing sites. Also, Biden said he will provide more personal protective equipment, such as masks and face shields. The president-elect also promised to give specific guidance on when to open or close certain businesses, bars, restaurants, and schools. Biden said his administration will invest $25 billion to manufacture and distribute vaccines when they become available.
And Changmin, just to remind ourselves about the daunting challenge that lies ahead for the Biden administration, do tell us about how grim the situation is over in the U.S.
Well, Sunny, I'm afraid to say it's very bad. The U.S. is adding tens of thousands of new COVID cases on a daily basis. According to Worldometer, total cases there have surpassed 10 million, the first country in the world to pass that mark. The U.S. has seen a worrying spike in the number of new infections since the November 3rd presidential election and the mass campaign rallies that took place in the run-up. The numbers are particularly worrying in several states, including Texas and California. Take a listen to what a medical expert had to say.
Right now, there are many parts of the country seeing record numbers of cases, and we have more than 1,000 people dying every single day. So this is a very serious situation with COVID, and it looks like it's going to get worse before it gets better.
The expert also warned that very few hospital beds were available for patients in some parts of the country. He says unless they do something to stop the outbreak, it could overwhelm their capacity to care for those who need medical assistance.
And hopefully that will not be the reality. Now, I understand Mr. Biden is also poised to re-engage with the global health body.
You're right, Sunny. So Biden is likely to undo many of President Trump's policies, and one of those is to reverse his predecessor's decision to pull the U.S. out of the WHO. Biden is looking to repair Washington's relationship with the global health body and coordinate a global response to the pandemic. The chief of the WHO was quick to congratulate Joe Biden and Kamala Harris on their winning the election. Take a look.
We congratulate President-elect Joe Biden and Vice President-elect Kamala Harris, and we look forward to working with his administration very closely. We need to reimagine leadership built on mutual trust and mutual accountability to end the pandemic.
On his Twitter account, he once again stressed the importance of global solidarity in protecting lives amid the pandemic.
Chongmin, one final question before you leave us. Could the pandemic situation over in the U.S. affect Washington's approach to Pyongyang?
Well, it could, Sunny. So Biden's, what's most important for Biden is to curb the virus. So, I mean, of course, foreign policy is important for Biden, of course, but for now, it may not be one of his pressing concerns. Of course, and also Biden's North Korea policy is not likely to resemble anything that was seen under the Trump administration. Biden is known to favor a bottom-up approach, which includes working-level consultations, while Trump favors a top-down approach that includes summits with North Korean leader Kim Jong-un. But Kim may not prefer Biden's style because he wants sanctions to be lifted faster through summit-level engagements. Taking into account all of this, the timeline for denuclearization on the Korean peninsula could be delayed. Take a listen.
Biden is more likely to focus on the domestic COVID-19 situation in the U.S. Also, given Biden's bottom-up style of negotiation, talks with North Korea could be postponed, and the North could express its dissatisfaction through military provocations, such as ICBM tests.
Meanwhile, South Korea's Foreign Minister Kang Kyung-hwa is in Washington, and she met her American counterpart, Mike Pompeo, on Monday. While there, she's expected to meet lawmakers and scholars from academia.
I see. All right, Chongmin, thank you for that. I'll see you again soon.
My pleasure.
Right, it's time now for the regular government briefing on COVID-19 here in the country. We'll come back to you after the briefing.
Let us now begin our regular briefing on the COVID-19 response here in South Korea for November 10th. As of today midnight, we have 71 new local infections, and the total caseload now stands at 27,653. 131 more people have been discharged, while 2,008 people remain in quarantine, and there are 54 patients with severe or critical conditions. We had 5 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today noon, we have some updates on the domestic infections by region. And in Seoul City, in relation to insurance company in Gangseogu District, we have 2 additional cases. A total of 36 have been confirmed to date. And next, moving to Gyeonggi-do Province, in relation to Gapyeonggun County private academy, we also have additional 11 cases being confirmed. A total of 12 cases have been confirmed to date. And in relation to a medical hospital and care facility in Gumpo City and Anyang City, we also have additional cases. And also we have seen that there is a risk factor in long-term care center, and that the beds were stationed too close together and people did not wear face masks properly. And next, in the non-metropolitan area in Gangwon-do Province, in relation to the Wonju City's healthcare device seller device, we have 1 additional cases, increasing the total to 17. And we have 1 additional case for the family in Wonju City, raising the total to 34. And moving on to Sacheon City, Gyeongsangnam-do Province, in relation to a couple there, we have the first index case being confirmed earlier this month, and we have 10 additional cases, raising the total to 11. And next, in relation to the therapeutics and research development, we have some announcements as well. As for remdesivir, as of 9th of November, we have administered the drug to about 731 patients around South Korea. As mentioned earlier, in relation to the blood plasma treatment, starting from the 16th of November for the next 3 weeks, in Daegu City, centering around the Sincheonji members, we will have a massive scale and extensive donations of blood plasma samples from their members. We would like to thank them once again, as well as we will also like to note that there are many clinical trials that are being carried out, and we ask for the patients to participate in these participations as well, and we ask for the participation by the medical staff as well. And moving on to live quarantine measures, we also have some announcements. Today, I would like to highlight the face mask wearing. First of all, face mask wearing is the most effective method and the easiest method to prevent yourself from the coronavirus, and in particular, preventing from the COVID-19, especially in the winter, as we have increased risks of the spread of the virus. We have higher risks of the virus spreading throughout our routine daily lives, and it is very much important for us to wear face masks in the indoor places. And starting from the 13th of October, we have been mandating the wearing a face mask, and we have given a 1-month grace period. And starting from the 13th of November, we will be having fines on people who breach such measures. And as for the revamp of the social distancing measures from 7th of November, we also have extended the number of face mask wearing mandatory venues. And we would like to note that these revisions is not aimed at penalizing people who do not wear face masks. However, it is about protecting our public from the COVID-19. COVID-19. And as we saw in the latest cluster infections, it is very important for us to wear face masks as much as possible. And at restaurants or saunas or swimming pools, and also at religious facilities, it is very important to minimize the time that we do not wear face masks. And also the same applies for call centers or the entertainment-related academies as well. And we will also like to note that these are the most important aspects of wearing face mask, and it is the most effective and most crucial way to protect yourself from the COVID-19. And here are more details of the fines. And as for the venues and places, locations that are subject to the fines are the facilities and multi-use facilities that have higher risk of infections. And on top of the 23 multi-use facilities, we also have included public transportation, pharmacies, as well as demonstrations and religious facilities, indoor sports stadiums, as well as call centers and the logistics centers, and over 500 members of the gatherings. And here we have some exemptions, and those under the age of 14 will be exempted from the mandatory face mask wearing. And also, aside from them, those people who have difficulty in breathing when wearing a face mask, and also those who cannot wear a face mask by themselves also will be exempted from these penalizations. And once again, we will highlight the proper ways of wearing face masks. First of all, wearing face masks that are made of a mesh or scarves are not acknowledged as proper face masks. And if you do not cover your nose and mouth completely, it is also deemed not wearing face mask as well, and you will be subject to penalties and fines. And when we spot anyone who is not wearing a face mask, and depending on the jurisdictional law, we will also have the personnel explain to you the reasons of the violations, and we will also be subjecting the fines to under 100,000 Korean won. And we will also mandate all of the personnel to explain these measures, and also as for these facilities and multi-use facilities that do not stipulate the face mask wearing measures, we will also subject them to a fine under 300,000 Korean won as well. And also the local governments have a discretion in adding and expanding the list of the facilities that are subject to these laws, and it is therefore important to check them before also, and we will also make sure that you could take a look at those information on our COVID-19 integrated website. And furthermore, with the COVID-19 confirmed cases, it is possible for them to be discharged after they have tested positive from the clinical trial, based on the clinical trials. However, there are also the measures that mandate people to submit a PCR testing results, and when they are actually released and discharged through based on these clinical assessments, we will also have the formulated templates to prove that they have been discharged fully. And in relation to life quarantine measures, we have additional announcements. We believe that during the year-end holidays, there are many gatherings and many events. So whenever you are going to these events and gatherings, please wear face masks and keep a good distancing with others, and wash your hands. Also, ventilate the space on a regular basis as well. And if you develop symptoms, please visit the clinical screening center as well to get screened. And we also have additional messages to the public. Currently, the COVID-19 trend here in South Korea we are able to contain the virus to a large extent. And the size of the outbreak is at a manageable capacity in terms of our medical capacity as well, and we are able to control the status to a certain extent. And following the Chuseok holidays, as well as the maple leaves, autumn maple leaves viewing hiking gatherings, as well as Halloween gatherings, we have seen some crises. However, we are able to contain the virus to a certain extent thanks to the participation of the public. However, we are seeing one on-day increase of over 100, and if this continues for the time being, it does not mean that it is okay for us to have an on-day case for a 3-digit case for the time being. And please note that COVID-19 can spread at any time and anywhere, and it is also important to note that COVID-19 can spread without symptoms even. So after a certain period of time, the numbers of COVID-19 could also increase and jump exponentially, and especially during the winter times, seasons, and it is very important to note that the virus can spread even faster. And as for example, here in Korea, Cheonan, Asan in Chungnam, as well as Wonju in Gangwon-do province, they have elevated the social distancing measure to level 1.5. However, we have not yet seen the need to elevate the social distancing measure to level 1.5 in the metropolitan area. However, we are mandating all of you to wear face masks going forward. And globally, we have seen an exceeding of the 50 million in terms of a global COVID-19 tally. It is similar with the total number of population here in South Korea. However, we believe that there are even more cases, at least 100 million people who could have been infected by the COVID-19, considering the people who are not documented. And also, please note that 1 out of 100 global population could be infected by the COVID-19. And also, as we enter into the winter season, we also have higher risks of the virus spreading even further and faster here in Korea. And here in Korea, we have also we are optimistic that we will have some results on our R&D aspects for the therapeutics and vaccines near the year end of this year. And we need to also highlight the importance of the need to take particular precautions at this stage. And we ask the public to continue to take particular precautions, and we are also exerting our full effort to develop our therapeutics and vaccines. And starting from next week, as mentioned, for the next 3 weeks, members of Sincheonji Church will also donate their blood plasma treatment as well as their samples for the development of the treatment. And there are many people who are participating in the clinical trials, and we will also like to thank you once again. And my thanks also goes to the researchers. And we have signed a deal with global pharmaceutical companies under the scheme of COVAX, and we are also exerting our full efforts to contain and also secure sufficient amount of the vaccines when they are developed. And we are also preparing these phases one by one. And as for the vaccines, we are also having the need to monitor the situation of vaccination in other countries as well. And also, please note that this winter without a vaccine, we need to also exert our full efforts to this end.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, there was Kwon Junuk, Deputy Director General of the Central Disease Control Headquarters with Tuesday's afternoon briefing. I have our Kwon Soa with me with a summary of the key announcements. Soa, do tell us the gist of his briefing.
Well, the gist today seemed to be masks, wearing face masks, because Kwon mentioned that it's one of the most easy but certain preventions for COVID-19, and especially with higher risks of infections with winter coming up, which makes indoor mask wearing even more crucial. And the reason for why he mentioned this today is because because beginning on November 13th, citizens, individuals, as well as businesses can be fined for not properly wearing those face masks. And under the revised social distancing measures, there are 23 facilities where face masks have to be worn. And he also mentioned that this is not to punish, the aim of this new measure is not to punish the people, but it is for the sake of the health of the nation's people.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Our work begins with getting COVID under control. I will spare no effort, none, or any commitment to turn around this pandemic.
In less than a year since the first confirmed case of COVID-19 in Wuhan, China, the global tally of infections has hit above 50 million, and the U.S. accounts for a fifth of these cases with more than 10 million. The incoming U.S. administration under Joe Biden, that is, has pledged to make the pandemic a national priority. And for more on this daunting task, I have Dr. Ko Myung-hyun from the Asan Institute for Policy Studies. Welcome, Dr. Ko.
It's my pleasure.
And I also have Professor Lee Hoon-sang from Yonsei University. Good to see you again, Professor Lee.
Thank you for having me today.
Meanwhile, joining our talk virtually is Catherine Gibson from the Voice of America. Pleasure to have you back, Catherine.
Thank you so much.
Dr. Go, following his victory speech this past Saturday, Mr. Biden has already launched a coronavirus task force, and on Monday he called on Americans to wear face masks. How do you assess his first action plan against COVID-19?
Clearly, the action emphasizes President-elect Biden's focus on handling the COVID-19 pandemic. Essentially, wearing the mask is the biggest differentiator between him and President Trump. Clearly, it was a very strange election this time because oftentimes politicians tend to run towards the center. So the messages tend to overlap. But in this particular presidential election, Trump and Biden essentially tried to run in opposite direction in a way. So President Trump tried to minimize the impact of the pandemic, whereas Biden emphasized the focus on handling the pandemic issue. And I think with that, I think President-elect Biden is trying to convey this the perception that he actually emphasizes science and reason over, and also as empathy for the suffering of the American public. So I think in that sense, it's essentially continuation his message. Essentially, it represents a consistency that under him, the United States is going to be a very different country. It's going to be a restoration of the traditional American values in many ways.
Right. Meanwhile, Catherine, over at the White House, at least 5 people, including Chief of Staff Mark Meadows, have tested positive for COVID-19, becoming the latest administration officials to be infected after a series of outbreaks in the West Wing following Mr. Trump's own diagnosis in early October. What is the atmosphere, Catherine, at the top office like right now?
Well, at the White House, there's always been this attitude that we have rounded a corner in terms of the coronavirus here in the United States. That's something that President Trump said on the campaign trail in the last days before Election Day. He wants everyone in America to feel settled, to feel like we have solved this problem, we are turning a corner and now turning to rebuilding the economy. Of course, as you just heard, President-elect Biden is making almost the opposite argument. We are heading into a very dangerous period here in the United States when there are going to be winter holidays, when people are going to be traveling around the country, and that is going to be spreading the virus around and increasing our already unfortunate numbers of COVID infections. This is something that we have to get under control, but remember, President Trump is still in charge of that coronavirus response for another 73 days.
Right. And Professor Lee, against this backdrop, I suppose an effective control over the COVID-19 situation in the US by the Biden administration will reflect positively on its overall future policy directives?
Of course, right now, COVID-19 response is, I think, one of the highest priority for the Biden's administration's planned response. And one of the first things that he will be doing, it will be rejoining WHO and responding to COVID-19 with full force. And of course, it will be different from President Trump's current approaches. It will be more science-based, and he will put so much of the big effort for the response. But the difficulty is right now this COVID-19 already has gotten into the situation that there is so much of the community transmissions. So once there is a widespread community transmission, it is quite hard to respond to the situations and control it. But anyhow, I think Biden will put best of his efforts. And I think if he succeeds in controlling the COVID-19 situation, I think it will give a big impetus for his administration's success.
Right. And along with tackling COVID-19, Dr. Go, Mr. Biden has vowed to rebuild the U.S. economy, tackle institutional racism, embark on immigration reform during his tenure. Do you foresee a significant reversal of Mr. Trump's policy under the Biden administration?
Well, there's what President-elect Biden can do and what he cannot do. I mean, we have to understand that even though President-elect Biden has won the Electoral College, the direction of the Senate is actually still not so clear right now. There's an expectation before the election that the United States is going to go through a wave of Democratic support, that not just the House, but then the Senate as well would pass on to the Democratic side. But that didn't turn out to be true, actually. So right now, the fate of the Senate hinges upon the 2 Senate seats in Georgia, which is going to go through a runoff next January. So until then, and also, even if a runoff happens, it's unlikely that the control of the Senate will pass over to the Democrats from the Republicans. So in that sense, the Senate is going to be the biggest break, so to speak, and Biden's drive to change essentially change the policy legacy of Trump administration, especially in the areas of immigration reform and then the climate change. But going back to the climate change, I think there's climate change is going to be one area where President-elect Biden can make a very important and immediate changes. For instance, Biden could rejoin the Paris Climate Control Accord, so he only needs a 30 days prior notice, so he can do it right away. And there are other administrative areas where, through presidential decrees, President Biden can actually reverse many of the diktats that President Trump had imposed on the American society. For instance, he could remove the travel ban against Muslims. So these are going to be symbolic, but then important measures that will change the perception of the United States in an immediate and in a clear way.
Right. And Catherine, what has been the response so far to Mr. Biden's intentions or initiatives?
Well, certainly there's a lot of support among the tens of millions of voters here in the United States who just voted for Mr. Biden in this past week. A lot of excitement and interest in how we may be able to turn a corner in terms of the COVID response. You know, Biden came out today and he gave this speech really trying to reach out to everyone among the American people and say, there's this very simple thing that you can do, and that's to wear a mask. Of course, he does face a stumbling block in the fact that in many parts of this country, people don't want to wear a mask. They feel that that's a matter of personal freedom. And up until the moment that Joe Biden is sworn in as president next January, he is not in charge of the response, and he can only work in a way with local governors and local officials. He's still not the person in charge of the COVID response. That's the president.
Right. And Professor Lee, Mr. Biden has pledged to heed the advice of health experts in the fight against the pandemic. As a health professional yourself, how do you respond to this fresh stance by the new U.S. leader?
So previously, or even at the present moment, President Trump had been making a lot of contradicting remarks from many of the scientific and medical experts. And even he discredited many of his own advisors. which had been causing a lot of confusions. And also it gave contradicting messages to the general public regarding mask wearing and many of the public health measures that people have to follow. So I think with Biden in his presidency, I think he will be relying very heavily on the scientific experts' opinions. And also I think he will give very strong support for any of the experts' opinion and their expression of their professional expertise expert messages. So I think it will be more consistent in terms of public health communications from the U.S. government. And also I think it will help overall COVID-19 response in the United States.
Right. Professor Lee, one question before we move on about vaccines, because at the start of the program we talked about how U.S. pharmaceutical giant Pfizer claims human trials suggest its vaccine is 90% effective in preventing COVID-19 in people. What are your thoughts on this development?
So this vaccine developed by Pfizer is mRNA vaccines, which was developed together with the BioNTech company in Germany. And this data of 90% efficacy is from the 94 COVID-19 cases among the 43,538 trial participants. And this trial actually will be continuing until they reach 164 cases to be detected. So these initial estimates will be there will be some adjustment in the effectiveness data after this trial is done. But still, this 90% is quite promising. But what we have to see is how long this immunity will last eventually, and for whom will be the target vaccine is that the vaccine will be given. And also the extent of the efficacy still has to be known more. So I think we, at this moment, is quite promising, but I think we will need more data. But also, because of the duration of the vaccine development time that is necessary, I think we will have this vaccine probably sometime in next year. So I think although it is quite promising, we have to see a little bit more of the evidence and data that has to come out, and maybe we will have to wait a little more until it is available.
Right. Meanwhile, Catherine, I hear Mr. Trump is planning to hold a series of rallies in the coming weeks to highlight his legal campaign against the outcome of the election. Do you see these events as fueling more outbreaks in the country?
Well, I think the first question we have to consider is whether that will actually happen. That was just one of the possibilities that was floated in the day or two after the election results. Remember, we have still not heard from President Trump either all day today or tomorrow. We have no public events on the president's schedule. So it really remains up in the air whether he'll be willing to go out back and hold these rallies and really admit to the fact that he lost to President-elect Joe Biden as he's still fighting those court challenges and making those claims of election fraud. I don't know that we're going to see that, and frankly, hopefully we won't, so that it won't trigger more cases as we see an upswing in the United States.
Right. Dr. Ko, keeping in mind the challenges that you spoke at the Senate level that the Biden administration faces, should Mr. Biden succeed in bringing COVID-19 under control in the U.S., would that provide him with the leverage required to perhaps push forth with other important agendas then?
Probably containing COVID-19 alone wouldn't suffice to give President-elect Biden enough political capital to pursue more reformist agenda he has in mind, such as injecting racial equity into the U.S. society, as well as changing the economic system that's actually creating a lot of inequality right now. So what it needs to do beyond containing COVID-19 is to have a very successful vaccine rollout. We know from Professor Lee that there are very promising signs that we'll have effective vaccines against COVID-19 soon available. So he'll have to first roll out the vaccines in a very effective manner, very quickly. The second is to fix the economy. We have to understand that the biggest point right now between President Trump and then differentiator between President Trump and then President-elect Biden during the campaign was how to handle the pandemic, also the economic repercussions from the pandemic. President Trump emphasized, actually minimized the impact of COVID-19. Instead, he tried to pursue a lifting of the lockdown and also essentially return to economic normality without fixing the pandemic issue first. And so that's clearly that cost him the election in a way. So, but even though it cost him the election, he actually had the right, hunch, so to speak, about the fact that the economy, it's a most important factor right now when it comes to COVID-19 in the United States. So I think for President Biden to be successful, to be actually credited with the successful handling of the COVID-19, he'll have to combine not just the public health measures to contain and eliminate the virus, but also to mitigate the negative impact of coming from the serious spread of the pandemic in the United States.
Professor Lee, on his campaign trail, Mr. Biden spoke of renewing U.S. partnership with the global health body, the World Health Organization, to better address the pandemic, a relationship that was crudely rejected by Mr. Trump. What are your thoughts on this?
So indeed, the president-elect Biden, Mr. Biden, was a long-time member of the Senate Foreign Relations Committee, and he is very far from being isolationist such as Trump. So I think he will take much more proactive approach for U.S.'s role in global COVID-19 pandemic response efforts. So he is calling of rejoining WHO will mean a lot because it will start from the officially rejoining WHO. Indeed, in the previous Obama administrations, in Obama administration's global health security response, actually they had a global health security directorate in White House. And but what happened was the Trump actually dissolved this global health directorate, global health security directorate from in the White House, just leaving a national security advisor only. So Biden was actually part of the Obama administration, and I think it will go back to where the global health security was the priority issue for the White House, and also I think he will really promote for the more active U.S.'s role globally. And also in terms of the soft power aspect of the U.S., I think the global health security issue, including the COVID-19 response, will be very almost priority, including the close collaboration with WHO. And also, I think he will not just see China's influence growing too much to the WHO. And I think he will try to regain U.S. leadership in global health efforts.
Right. Catherine, as you mentioned earlier, the new incoming Biden administration is poised to witness some public unrest over certain COVID-19 measures, such as mask mandates, as you mentioned. But then again, if you think about it, these are part of the challenges the new administration faces, along with that of bringing the nation together, right?
Absolutely. And I think that we also can't underestimate the impact of the delay in the presidential transition. This is a massive undertaking whenever you're switching from one presidential administration to another. And because President Trump has not conceded the election yet, he's directing some government agencies not to transfer over some of those resources that the incoming presidential administration needs to get going. Just to take a look at the scope of this, we're talking about 4,000 employees, hundreds of people who need to be confirmed by the U.S. Senate, taking over a 2 million person civil service. This is a massive undertaking in just a little over 2 months. And with a pandemic raging here in the United States, every single day is important, and that really needs to work in President-elect Biden's favor. He needs every moment of that time to plan that response.
Right. Dr. Go, Seoul's top diplomat, meanwhile, Kang Kyung-hwa, is currently in the U.S. to meet with officials there over bilateral matters related to the Korean Peninsula amid the pandemic. What are your prospects on the future alliance between Seoul and Washington, and perhaps to a greater extent, the alliance between these two and Pyongyang?
Well, I mean, the prospect for the alliance is pretty brighter under President-elect Biden than President Trump. We know that the President-elect Biden has emphasized over and over the restoring the the alliance of the United States and also respecting the allies again. And that's probably music to ears to many supporters of the US-ROK alliance here in Seoul. But on the other hand, when it comes to North Korea, I think that we have a lot of challenges ahead. The problem, the biggest challenge for Biden administration will be how to continue somehow the dialogue with North Korea that's conducive to denuclearization. We know that President Trump has tried in the last 3 years and didn't quite work out. And the biggest hurdle has been North Korea's unwillingness to engage in denuclearization. And President Biden's dilemma is how to implement denuclearization while managing the situation in the Korean Peninsula so that it doesn't get out of control. And actually the same challenge lies ahead for the President Moon, because President Moon's room for maneuver under Biden administration will be much, much smaller than what used to be with President Trump, because President Biden has other foreign policy priorities. Probably Russia and the Middle East are likely to be his top foreign policy priorities, and that means less attention paid to North Korea, and that's what North Korea doesn't like. So we have a lot of homework to do for both President-elect Biden and President Moon, and we have to pay close attention to the situation.
Right. Professor Lee, perhaps we could end with a very few words from you about advice that you'd like to extend to the incoming U.S. administration with regard to reining in the world's worst outbreak.
So I think before responding to global pandemic, I think what is the difficulty lies in the fact that U.S. is in one of the worst situations in terms of COVID-19 outbreak situations. And as we can see in France and UK and other European countries, even though you really resume all your efforts for the COVID-19 response, once COVID-19 really spread it out into the full community transmission, it will be really difficult to control it. But I think before COVID-19 pandemic began, in the global health security evaluations, United States was #1 in terms of its preparedness and expertise and human resource in terms of, and they were the first place in terms of the global health security index. And as everybody knows, they have all the expertise, and US CDC has one of the best expertise in the infectious disease response, and also they have so much of the academic capacity as well. So even though it will be a difficult fight, so it will be very long and arduous fight, but I think that there will be a lot of chance that the United States will pull it together and make very creative approaches in solving this problem. And also, but I think it will need very strong and very focused and very capable leadership from the President Biden. But I think it will not be an easy fight, but I think but it will be a worth battle to fight on. So I wish all the best for our public health colleagues and President Biden for their response to the COVID-19. And also, I really wish that U.S. is to be back in the global health arena by rejoining WHO and really exerting its global efforts as well for global pandemic response together.
Right, and on that positive note, we'll end today. Thank you, Professor Lee, for your thoughts. Dr. Go, as always, thank you for being with us. And Catherine, over in the US, thank you for your thoughts and time.
You're welcome.
Right, and on that note, we end today's edition of COVID-19. Tomorrow, we take a look at the renewed interest in Korea's handling of the pandemic amid the resurgence worldwide. Do take care. See you tomorrow.